This is the self-instruction for manual lymphatic drainage for the legs. The body is broken up into quadrants for the lymphatics. We are split down the middle and across the line at the belly button. So if you have problems with swelling in your legs, we will be trying to redirect the fluid up towards your armpits, past your belly button line. With ovarian, testicular, prostate cancer, you will have lymph nodes removed and or radiation. We will want to redirect the fluid around to the side of your hip, not going directly towards your groin where the lymph nodes were removed. If you have chronic venous insufficiency, you can move it straight up to the groin or to the side, like we are going to instruct. So we start our sequence with flat strokes. We want you to repeat 10 times on the spot. The strokes are a very light stretch of the skin, unidirectional, so we will be moving this fluid in one direction towards the outer hip. We're starting at the neck. Then we're going to proceed towards both armpits. You can do one at a time, like she's demonstrating. It is good to know if she has swelling in her right leg only, this is the only armpit she will need to do. She would not have to proceed to the other side. Then you go to the groin, having the middle finger at the panty line or underwear line, flat circles 10 times on the spot. Then we go to the stomach. Place your hand right over your belly button and provide a little bit of resistance to your breath as you inhale. Repeat 10 times. This will assist in helping milk the fluid or pull the fluid away from your legs. So that is a good exercise to do just throughout the day, the diaphragmatic breathing with the resistance. You'll start at the thigh with flat strokes, semicircle, pressure on, pressure off. 10 times on the spot. She'll proceed down her thigh. For demonstration only, she is repeating just a few times, but you would repeat 10 times or more depending on the swelling that you present with. She's also going to go to the lateral or side of the thigh with her strokes. If you are flexible enough, you can do the posterior leg and medial leg. Then once to the knee, she's going to somewhat interlock her hands underneath and provide a little pressure up and around behind the knee. 10 times. Then she's going to go to the side of the knee and have that semicircle movement coming up towards the groin. 10 times on the spot. Very light pressure. She can continue that on top of the knee with the light pressure. Getting a good stretch of the skin, allowing the capillaries to refill. She will proceed down the calf in the same manner. Ten times on the spot. Flat semicircle hands, very light pressure. Depending on the spot of where the swelling is, you can concentrate more strokes in that area as needed. She'll bring those strokes all the way up to the knee. And then, depending on if you have swelling in the foot, you can perform those flat, very light strokes over the top of the foot. Sometimes around the ankle bones, it can swell quite frequently, so you can do those flat strokes right around the ankle bone, sometimes using both hands. And the end stroke, she's going to do those flat hand strokes all the way up the leg to the outer thigh. Emphasizing the areas that are of most concern. You would repeat this long stroke 10 times, all the way up to the outer hip. It is important at this time to go up the trunk from that point, because we're going to be using those lymph nodes in the armpit. And the important aspect to remember is to cross that line at the belly button. Repeat that sequence 10 times. You will end the self-massage at the neck, 10 times on the spot, very light pressure. This ends the demonstration for self-massage for the legs.